A very good morning, doctors. Very good morning. So yesterday we posted a video regarding you know, the the dates that will be taken into note by the NBEMS regarding the Neet PG 2024 examination. And I also gave an information regarding the best specialities that you can select or achieve through this Neet PG gateway. But some of the doctors has raised me a good question. Now I'll tell it. I will just explain it one by one. Don't think like I will just take a long spread of time. No, just I will make it cut short. Okay. Now the first one is, sir, is radiotherapy good or not? Doctors, radiotherapy is good, but it may not have that much of fruitfulness for the next 10 years. That is one thing that I can say. It may have, but not in much of the hospitals, much of the corporate hospitals. Trust me, I've been through nearly 2 to 300 hospitals. I've been to regarding academics only. It's not regarding clinicals, but regarding academics only. I've been to nearly 200 to 300 hospitals. Radiotherapy is not at getting into the roots of the real clinical core skills. No, radiotherapy is still a long way. Don't think like if you take radiotherapy, yes, you can get into the clinical sense as soon as possible. No, not like that. Not like that. Radiotherapy still has a long journey to travel to get into that sort of clinical core, like other subjects. You take orthopedics, pediatrics, all this sort of clinical course. So radiotherapy, it has some fruitfulness, but only in some peculiar hospitals. Peculiar means I am here talking about multi-corporate hospitals. Multi-corporates, not even corporate. Multi-corporates, they are nearly in numbers. They are really in numbers only. So radiotherapy is still having a long journey to reach to that level of peak. And one more doctor is asking, sir, even anesthesia is a good department now. What is the chances of having anesthesia as a bright future? Doctors, anesthesia, see, I will tell you one thing for sure. Nearly 23 of my friends, so 23 of the doctors who I know, they perceived anesthesia as the specialty. But trust me, only 3 to 4 members are doing good. Trust me, only 3 to 4 members. Yes, rest of the people, they are getting somewhat like, yes, okay, like money. See, we are not talking about money also. It's about, you should go to that sort of level, like you should cover each and every clinical aspects as soon as you finish the specialization. So that is what the real achievement means. Achievement means not about money. See, you get 3 lakhs, you are fully settled. No, that is not at all right. Why? Because today you may get 3 lakhs. Tomorrow, if you get a better doctor than you, then obviously you will be putting a question mark. You see, corporate hospitals work like that. Obviously, corporate hospitals work in that way only. If they get a better doctor than you, then obviously they will simply set you aside from all sort of operations, surgeries, everything, and they will give chance to that new doctor who has a better skill than you. So what I am speaking here is the departments yesterday which we explained, like surgery, emergency medicine, and one more thing we explained, orthopedics. These 3 departments, if you perceive with your full commitment and will, obviously you will have a bright future as soon as you relieve from the college. But yes, yesterday one doctor was asking, sir, anesthesia don't have that much? Doctors, anesthesia is, it's like a bridge. It's not a direct specialty. Of course it is a direct specialty, but it's like a bridge nowadays it's like a bridge. Why I'm using the word bridge? Because anesthesia, see, most of the doctors are slowly learning their own self anesthesia procedures. For example, if you take gynecologists, previously gynecologists used to call anesthesiologists for giving spinal, for giving rest of the anesthetic procedures. For example, of course, the pelvic anesthesia, that is the pudendal block. Right now, actually, pudendal block is not practiced that much frequently, but still there are some good doctors who are giving the pudendal block. So, and as previously in olden days, that is something like you take 10 to 13 years back, gynecologists used to call anesthesia specialty doctors, that is anesthesiologists, for giving the anesthesia regarding spinal, if in case of C-section or in case of vaginal hysterectomy, like that. But nowadays what doctors are doing is they themselves are practicing the self anesthetic procedures. That means they are practicing their own anesthetic procedures which are used in their operations. For example, a gynecologist himself or herself is giving the spinal anesthesia to their patient if they want to conduct a C-section. So they are not calling the anesthesia doctors anymore. See, it's a very rare thing I'm seeing. For example, I've seen a bunch of doctors who are actually gynecologists who are giving spinal anesthesia they themselves to the patient. They are not calling the anesthesiologist. So the situation is going on like that. Now, why I'm saying bridge? Why I'm saying bridge? Because anesthesiologists, they act as a bridge because they go into both operative, that is by giving anesthesia to the patients, as well as emergency management also, that is the emergency clinical skills in the emergency ward or emergency ward, that is emergency casualty, because anesthesia is the only person who can go for JV catheterization. Anesthesiologist is the only person who can go for intubation. So these type of things are only done by anesthesia people. So these are the only things right now are being done by the anesthesiologists in the corporate hospitals. Rest of the minor anesthesias, they are being given by the clinical practitioners only. That is, if it is surgeon or if it is a gynecologist, like that. But in government hospitals, you have a separate anesthesiologist. So obviously that anesthesia person will have a good work, will have a good skill, because every anesthesia should be given by that anesthesiologist only. No clinical practitioner, that is either it is a surgeon or it is gynecologist, they will not give any sort of anesthesia. So anesthesia's procedure is like that. Now one more doctor is asking me like, sir, what about dermatology? See, dermatology is a good branch. Yes, dermatology is also, see, all these branches which you are saying, anesthesia, dermatology, and one more thing, what is that? What I forgot that. Anesthesia, dermatology, and radiotherapy. Yes, all these branches which you are saying, like, you can get a job. You can get a job. But what I am actually speaking is a good settlement in life. I am speaking about. I am speaking about a good settlement in life. It's not about getting a job, right? See, job any doctor will get, right? See, whatever, from which college he might pursue his degree, or from which college he might get his post graduation, but still a doctor will get a job. Even MBBS doctor will get a job, man. That is not at all a problem. So what we are talking about here is a person who have a good settlement. Settlement means, see, doctor, if his name is not getting into the roots of society, then what is the point of becoming a doctor? Doctor means you yourself should get a good name, good fame. Yes, he is a good surgeon. Yes, he is a good physician. Yes, he is a good practitioner. So you should get that name. If you will not get the name, simply if you get the money. See, radiologists, don't get offended. Yes, I know your point, sir. Then that means no patient will know our name. That means we are not that a good doctor. No, not like that. See, radiologist is a self-opinion. Radiologist is self-opinion. People who want to have a happy life, sleeping, enjoying, eating, hanging with wife, playing with children, if you want to have all this sort of complete circle and a minor part of working in the hospital, then radiology is the best branch. Trust me, radiology is always the best branch. Why? Because radiologist is the only branch which can be practiced from anywhere in the world. For example, you are working in a hospital, like you are working in a hospital, that is say some X hospital. Now suddenly you just went to a movie, or where you went to a tour some abroad tour to abroad with your wife or with your girlfriend, right? Now suddenly some patient was getting into the hospital. He is in an emergency condition, so he was taken with a CT chest or CT brain. Now you should see check the patient's condition. But you should go to the hospital? No. The CT will be sent to you through mail or through WhatsApp or whatever it is. In the photo itself, you can just scan it and you can simply say like, yes, the patient is having so and so condition. Yeah, give this information to the surgeon, neurosurgeon or cardiac surgeon, whoever it is. You can simply give your report from anywhere in the world. So radiologist work is like that. So there is no headache, there is no attachment with the patient will not know your face. You are completely a person from the background frame, not in the foreground, right? So what we are talking about the radiography, dermat, anesthesia, all this sort of the specialties. Yes, they are good, but they are good only in some corporates. Just because pursuing dermatology will not make you getting a better opportunity in the corporate sector. That is one hook or crook shot that I can give you an assurance. You become a dermatologist, you may not get a better chance in the corporate sector because you have a bunch of dermatologists, right? That will not make a statement like only surgeons will settle good in your life. No, not even like that. See, it all depends on the workman, but I'm saying some clinical branches which are medical oriented, that is physician oriented, only some branches will have a better fruitfulness, right? You take pediatrics. Yes, even though it is a physician oriented branch, pediatrics is a physician branch, but it still have a good fruitfulness. But surgery branches, every branch is good. You take ortho, you take surgery, gynec, every surgical branch is absolutely good. So that is what I am saying, right? So some of the doctors are getting confusion, right? And one more thing, recently we are getting an information like inicet is going to be postponed, right? See, doctors, actually it's information from the sources, but it's not yet confirmed. But chances are there that inicet exam might be postponed. But still, leave all about that situation. You prepare for the inicet. See, now you have a good chance of preparing parallelly for both Neet PG and inicet. But the only thing you have to have is a fine grilled chisel thing in these final days, right? So actually I am starting a new course regarding a parallel preparation for Neet PG as well as the inicet also. So kindly doctors go through all these classes. These classes consist of tests and discussion and very important MCQs, previous year questions from nearly 350 topics. Everything will be covered, every pinpoint subject will be covered. Nearly last 15 years, you get this word, 15 years PYQs will be covered in these classes. So actually these classes are exclusively for target inicet. Yes, Neet PG also will be covered, but my classes, so we have a bunch of staff who are very much waited to start their classes course. So it will be started within a short couple of days. So get ready, go through these classes. This one hell of a big short preparation for the inicet, upcoming inicet, right? Now through this course, what you will get? So many doctors are asking me, sir, from this course what we might get? Will we get a seat in inicet? I can give you assurance, like with this course which I am about to start, which our team is about to start within a short couple of days, you will achieve not less than 75% of proficiency, 75 to 80% of proficiency in inicet. Now rest of the 20% relies on your practice. Rest of the 20% relies on your practice. So what you practice, how you practice, what sort of resources you use, obviously. But the notes and materials which we give, see, everything is free. I'm not a commercial person because I have a good job. I have a good earning status, so I don't need to earn all this sort of money. See, the only motto of myself to give these course classes in a free way to the students is, I just want to be a good doctor. I want to utilize my knowledge to get into the students. That is the only reason why I am doing this course, right? So I will gather a good team of doctors who are proficient in their specialties, right? And even if you want to have any doubts regarding the selection of college, regarding the specialty, yes, I'm going to post that video in a couple of days, maybe tomorrow or day after tomorrow, I'm going to post a video regarding which specialty is best in which college. So please doctors, please follow that lead, follow that video very clearly. Don't think like this college is good, I can select any specialty from that college. No, it's purely wrong. It's purely wrong. Don't think like that. No college is best in every department. Trust me. Even the best college is sometimes deficit in a respect to specialties. It may be deficit, or it may be a little bit low than an even more worse college, right? So tomorrow or day after tomorrow, I'm going to post that video. So just check through that video, right? Which specialty is best in which college, which specialty is better in which college. So every college will be covered in it according to your area, region, according to your state. Every college in this country will be covered in that video, every college. So even in that video I will give all the markers also, right? So which state at which timeline it will be present in that YouTube video. So for example, if you are from Punjab, or if you are from Haryana, or if you are from Delhi, you can straight away go to that timeline, and if you click there, the video will start from there, and from that point the colleges present in Delhi will be shown. Which specialty is good, which college is good, regarding which specialty, everything will be covered, right? So this is the information. So if you have any sort of doubts, please feel free to ask me. Please put it down in the comment section, and just wait for the upcoming video, right? So tomorrow or day after tomorrow. And doctors, please, it is a free course. It is your best chance to prepare for inicet. So we will be conducting nearly some 300 to 350 classes. 300 to 350 classes, all videos will be posted. Please doctors, follow these classes. It is very much useful. Nearly 76 to 80% of your proficiency will be done in these classes only. Rest of the 20% relies on your practice. Please doctors, please utilize this course, which is free, completely free. No money will be charged for it, completely free. Our team is being preparing for these videos, for these classes, for the past 4 months. Trust me. So please utilize this chance. The classes will be started within a short couple of days, right? So get ready with your notes, pen and paper. Okay, thank you, your wise doctor.